So as a parent, you know, your kids come to you with bumps and bruises, little cuts. And here's my daughter coming to me with her jaw issue, misalignment of a jaw.
I have patients coming in that would like corrective surgery because they know the impact this is going to bring to them.
I always wanted to hide my smile. I always tucked my head down, didn't want them to see me laugh or talk. I felt like when people got too up close to me, I didn't want them to see what I saw when I looked in the mirror.
People come to me all the time because they say they want straight teeth. And what they're really telling me is that they want a more confident smile.
When jaw position is off or not well aligned, I can line up the teeth. We can hold them fairly well with retainers. But ultimately, if the jaws are not well aligned, the teeth are not going to maintain their position quite as well. Stability will be compromised.
As a patient goes to their orthodontist and says, "Hey, can you correct my smile?" What they don't realize sometimes is that there is a skeletal problem. And if we don't correct the skeletal problem, just correcting the bite is not going to be stable long term.
A lot of times with braces, I can get halfway there. I can give them a significantly improved result, but without the jaw surgery component of it, I'm limited on actually what I can change.
And granted, there may be an additional expense, and some patients are concerned about that. But of course, we want to get the job done right. Not only for us, but for the patient. They come to us seeking the best treatment possible.
Surgery becomes an important tool for me as an orthodontist to give that patient that ideal result that they're looking for, that Hollywood smile that everybody wants.
Now, in certain circumstances, a person grows in a manner in which the jaws just don't fit together. Regardless of what I do to try and compensate for that growth, sometimes we need a surgeon to go in and move those jaws and put them into the right place.
When I have a case, I send him for orthognathic surgery to fix a jaw structure. He'll have it all on digital technology, 3D imaging, and so I feel very comfortable sending my patients there, and I know they're going to receive the best care possible because he does stay up on technology and he's cares for his patients.
So I used to have to rely on just a 2D image. You can see that I can manipulate the chin in one way or another, and it kind of gives us an idea, as you see this red line moving, where I'm going to manipulate the chin. We used to rely on x-rays that gave us a frontal view of the patient's skull, but they were very, very poor in nature. Now we have 3D imaging. I can take this picture now and even go further, and using specific software, I can actually plan a surgical case by manipulating the jaws in the software itself. You know, we did a surgical planning to see where we would like to fit the patient. You can see that when she's smiling, she may show a little bit of gum tissue that she didn't want. Her midlines may be off a little bit, and even her chin is off to the right a little bit. When we're looking at her from the side, we can see that her profile has this concave profile. She didn't like the proportions of her face and wanted that changed. And I can see where there's certain asymmetries, and some I may be able to correct and some I may be able not to correct, but for the most part it allows me to manipulate the jaws so that things look fantastic. You can see that where the different colors are actually where the bone cuts are made. Not only am I seeing where I can make bone cuts and where asymmetries may develop while I'm doing surgery, but I can also see the nerve in the jawbone. And it gives me more evidence as to where I need to make correct bone cuts and where we need to separate the jawbones. Our ability to manipulate the jaws even more accurately have been magnified by technology that we now have.
In any surgery case, we have to work closely together with the surgeon. We collaborate together in issues of, we take the models and basically do the surgery in hand and look at that together and make sure it's exactly what we both want and what we both need to accomplish.
And what happens is the orthodontist actually will send me a patient if they think the patient needs jaw surgery. I will do an exam, and then we will collaborate together.
It's very important that I have a good working relationship with the surgeon. It's a process. The braces will be on for several months. I'll be talking with Dr. Stosich to make sure that I have things set up right for him when you go in to see him. And he'll be talking to me, making sure that once he's done with the surgery, that I can finish things how I want to have them finished and have a great result. Nice broad smile, nice balanced facial structures.
So if I recommend orthognathic surgery and the patient chooses not to have orthognathic surgery, some of the concerns that I have are negative tooth wear, some of the cosmetics that they'll have, the influence of those cosmetics, and the long-term stability.
We want to treat somebody for the long term. You don't want to treat them just for the day or the year that they get their braces off. You want their result to last forever.
A lot of people come to me after they've had orthodontics and say, well, my chin is too small, or my chin is too retruded. How do I fix that? Or I have a double chin now. And these are patients that had orthodontics 10 years ago, 5 years ago, 20 years ago, and now they have these complaints. As a teenager, it's really hard to see that. And I think as a teenager going to an orthodontist and having an orthodontist tell you that you need surgery, that's a big deal.
So in addition to confidence and aesthetics, one of the most important reasons I recommend oral surgery is for function. In fact, if there's not a functional need, I won't recommend that they have oral surgery.
That functional piece is imperative. Why? Because the teeth last a lot longer when they fit together properly. You know, I see patients come in all the time where the jaw doesn't fit, and not only do the teeth wear down quicker, but the bite doesn't work, the digestion is changed, embarrassing moments oftentimes happen. And in those circumstances, I feel it's absolutely important to get those people to an oral surgeon.
One thing that a lot of people may not think about is how significantly the alignment or the position of your jaws can affect your overall medical health, whether it's with regard to sleep or headaches, grinding and clenching at night. The position of your teeth and jaws can significantly impact those areas of your life.
When we team up with an oral surgeon and do good work, the two of us together for the benefit of this patient, we not only establish a better bite and better function, but we give them a better sense of self-worth, better confidence that serves them throughout their lives.
And smiling was a little difficult because I always knew it was there. I would smile and I could see that it was different. And I would watch movies and see people's perfect bites and smiles, and always knew that I probably would never look like that.
So I myself, as a child, my bite was so far off and my teeth were so messed up that I wouldn't smile. I was scared to talk to girls. Even going in to talk to a teacher, I would hide my teeth. It took a number of years, but through braces and then going through a surgical procedure myself, it changed the way I felt about myself.
So it was really important for me to find a surgeon that I felt would take care of me, that wouldn't try and make me do something I didn't want to do, that didn't want to change my appearance, just would fix my problem. One I would feel comfortable with. My appearance, my health, everything's in their hands.
A smile defines a person, and we want that to last in our patients. So going through both the orthodontic and the oral surgery procedure is well worth it, because your smile will define you for the rest of your life.
But I really feel like this surgery was delaying a big part of my life because I wanted it so bad, and it was the first thing that I wanted, that once I got it, it was just a huge open field of other opportunities and things I could go out and get, because this part of my life that I've always wanted was finally accomplished.
I think one of the most rewarding things for me as a surgeon and doing this procedure, which is one of my favorite procedures to perform, is the delight of a patient when it's all said and done. After they've healed, after their braces come off, I've seen patients time and time again come in with a great smile, and they're very thankful that they've gone through this surgery.
So after the surgery, we knew it was worth it. I mean, we could tell day after the surgery that she looked different. She was so happy. I mean, as soon as Dr. Stosich came into her room, she hugged him. Even though she was in pain, she cried and was so happy that her life was going to be for the better.
With my patients, my reputation is on the line as well. So even in regards to who I refer to, that's why I refer to Dr. Stosich for our jaw surgery cases. I have complete confidence in him that he is seeking the same outcome I am.